The major purpose of these videos is to show you how to use the anatomy that you're learning about now and to provide an earlier exposure to the field of plastic surgery than you might otherwise see until you're a third or a fourth year student. These videos are designed to simulate real plastic surgery procedures that we use to reconstruct defects in the human body. These defects can be created as a result of cancer surgeries or trauma or just in general replacing like with like. So that in general is called a flap. And what we mean by that is a piece or a block of tissue that is supplied by an artery, drained by veins, and has some form of innervation that will survive after it has been moved or transposed from one part of the body to another. There are 5 types of flaps that are categorized according to their blood supply. A type 1 flap has a dominant vascular pedicle. A type 2 flap has one dominant inflow and one minor vascular pedicle. A type 3 flap has 2 dominant vascular pedicles, and a type 4 has segmental vascular pedicles. What that means is that each portion of the muscle is supplied by a slightly different artery, and those vessels in particular are very finicky. A type 5 flap, which is the last one we'll talk about, has one dominant vascular pedicle and multiple segmental vascular pedicles. The first flap we'll be talking about and that you will see demonstrated is a gastrocnemius flap. This is a flap from one of the major calf muscles, and we'll also be talking about the soleus muscle and the flap based on that muscle as well. So for gastrocnemius flap, it typically is raised quite quickly. We're basically detaching it from its insertion, and we're rotating it into the field where we need to cover the bone or the hole that's necessary. A gastrocnemius flap is one of the quicker ones that we can do. We're not really worried about the vascular inflow because it is so robust, as we mentioned in the video itself. And a typical operation like this would take less than an hour to do. We then need to do a skin graft as well in most situations, and that adds another half hour to the procedure. A single surgeon can do this if they have good help, and by good help I mean usually a resident and a surgical scrub nurse. And the number of times that we would do this operation in a busy trauma center like Rhode Island Hospital would probably be about 10 to 20 times in a given year.